I'm Jeff Bernhard, President of Commercial Markets at Highmark. Welcome back to Season 2 of Hitting a Higher Mark. In this podcast, we explore topics that are transforming how healthcare is delivered, used, and paid for. Today, we'll be discussing how to access information that is empowering members and changing the way we seek care. We have two special guests with us here today from Highmark to tell us more about this topic. I'd like to welcome Lisa Marsh, Director of Clinical Strategy, and Dr. Philip Majewski, Senior Medical Director of Clinical Sales for Commercial Markets. Thank you for joining me today. Let's dive into today's topic. First off, Lisa, can you explain the benefits of provider quality and cost transparency?
Absolutely, Jeff. We feel that provider quality and cost transparency can enhance the member experience. I think it empowers them to be confident as healthcare consumers. It gives them a peace of mind that they're making the right decisions related to their healthcare. And this can be really important because it could be a matter of life and death. We know that unnecessary care and poor quality can lead to increased cost, poor member experience, and poor outcomes. And the timing is really important also. We recognize that by identifying members early in their healthcare journey, when they need us most, and when we can make the biggest impact, that is essential. We'll be using smart technology to identify them upstream, to support them with quality and cost-efficient data, to get them to the right provider for the right reason at the right time, and this will lead to better health outcomes and lower healthcare spend.
Yeah, Lisa, I think that's exciting. I think most people, when I think about it, don't realize that especially provider quality transparency hasn't been available in the past. And it's exciting that Highmark will actually be the first carrier to provide quality transparency by physician across the United States, of course, with an outside vendor. So has the market been asking for this? Like when you talk to consultants and brokers and clients, have they asked this in the past, or is this just something that Highmark is bringing to the market?
No, they absolutely have. We've heard from the customers loud and clear. They want a solution that simplifies the member experience. They want better health outcomes, and they want the ability to cut cost. And we know that begins with quality. We also heard from the members, from the patient. They want quality and cost transparency data that they can trust, and they want somebody that can help them to use it.
I understand Highmark is getting ready to launch a new product, Well360 Clarity, that will help further bring provider transparency. Dr. Majewski, tell me more about this product and why it's good for the market.
Yeah, I can, Jeff, and thank you for inviting Lisa and me to speak with you today. And thank you for that opportunity to talk about Well360, our portfolio, and our most recent addition to that, Well360 Clarity. We started the Well360 portfolio several years ago, and we have about 1 million members on the platform itself. This newest enhancement, Well360 Clarity by name, it brings member navigation to the right care from a quality and cost perspective. It will accomplish this with a high-touch concierge experience and enhance advocacy and clinical support to address top cost drivers. It does this by using real-time data and artificial intelligence technology, as Lisa mentioned, to identify the earliest moments when a patient may consider or will need a provider for a particular procedure and service. Coupled with that, the quality and cost navigation, Well360 Clarity will indicate where higher value yet underutilized preventive services and chronic disease gaps exist, so that we can take action with members and their treating providers to close those gaps and achieve better clinical outcomes. So you ask why Well360 Clarity is good for the market, in addition to the reasons that we're being responsive, as we always try to be, but it also drives provider activity to higher value, and that being higher quality at a lower cost.
So let me kind of interpret that a little bit. There's a lot to that. So I think from an AI perspective, that's really important. I think the listeners or people watching this need to know. So what that means is that we're using artificial intelligence upstream. So as an example, we see a patient has an MRI through a claim. Usually following that, they're going to visit an orthopedic surgeon. So I assume you're able to interject early prior to an authorization for a procedure and interject with a patient to be able to guide them to a higher quality, ultimately lower cost because of efficiency doctor. Is that correct?
That's correct. You got it.
Yeah, and I think that the thing that I think is really important, and the reason why this product for Highmark is superior in many ways to buying it from an outside vendor, is you really, I keep saying upstream. You got to go upstream. You've got to be able to get people before they already go down a certain care path, because once you take the time to meet a doctor and so forth, even if the doctor's quality rating is 30% versus 95%, many times people don't want to go through the process again. They get the authorization. So by going upstream, I assume this gets them to the right place the first time.
Yes, absolutely. Building that relationship with the provider takes time. And like you said, most patient members don't want to do that twice.
Yeah, I agree. So Lisa, if provider transparency is our goal, how's Highmark executing on that?
Yeah, Jeff, great question. It really comes down to the people resources. I mentioned earlier that quality is really important. Sometimes people don't know how to use it. So we really have to help them throughout the entire process. So we know that the market has tried different tactics. They've tried apps, they've tried making things available in print form or on their web, and we know that it's not worked well. So we're really creating a journey that focuses on that human element, that of course, there's going to be some support from technology, but we also know that empathy and human compassion has to be part of our solution. So we're presenting this information timely, what's needed relative to quality and to cost to our members, and we're doing it through human interaction, through our people resources. That's what's going to make us successful.
Yeah, so I think that's really important because you said a key word, or empathy. I think empathy is there's a big deficit in empathy in our market. And I think, it's nice to think that this, cell phone will help steer someone to the top doctor at the right time, right place, and right time. And I don't care what age. I have an 18-year-old, and if I gave her this phone and said, go at it and try to figure out how to get the highest quality doctor at the best cost, and by the way, don't mess up because you're going to be financially liable, she wouldn't have a clue. And neither would someone that's 50 years old. Let's be honest. The system is so complicated. So I'm glad that Highmark is creating a product that's backed with empathy. So it's human touch, but I assume we do support that human touch and empathy with technology, right? So if I'm talking to you and you're an advocate and I say, I'm looking for a great neurosurgeon for my spinal surgery that I have coming up, I can talk to you. You can help guide me to the right doctor, but you can also text me or email me information on the choice of doctors to choose from, right?
Absolutely. We're taking an omni-channel approach. We know that not everyone wants to engage just by phone. So we're utilizing text messaging, email, and digital messaging. We think it's important to give members that vehicle in which they want to communicate and receive information.
Yeah, and I think so. The best way of saying it is the technology complements the empathy and the human
Absolutely.
touch. So Lisa, so I'm thinking this through. Under this program, you recommend people to the highest quality doctors in the area. You recommend them to the most efficient providers, which leads to lower costs for their employer, but also lower costs for them, right? Because everybody has higher deductibles and HSA accounts. So what type of clients are a good fit for this type of offering?
Yeah, first and foremost, we take a consultative, data-driven approach to ensure that we're matching the client goals and opportunities to the right solution. We have a team of clinicians here at Highmark that use data. They use an opportunity assessment and their clinical expertise to make client-specific recommendations that we know leads to success. So clients that are looking for a solution that simplifies the member experience, improves health outcomes, and reduces their overall healthcare costs needs to learn about this product.
Which pretty much names every employer in the market. So that leads me to my last question for both of you. There's obviously a cost. The price of great service and concierge service isn't free. So what's the guarantee that Highmark puts behind this product? Phil, let's start with you.
Yeah, thanks, Jeff. Because it's part of our Well360 portfolio, we know that there are components that have been tried and true over the last 5+ years. Currently, we have a product, Well360 Connect, that has showed 3 to 5% savings on an annual basis, depending on the client. And we know that we're adding to Well360 Connect in the new model, Well360 Clarity. So it takes that savings to the next level with more clinical outreach to members and providers, but also providing that site of service guidance and guidance to the highest rated quality providers.
In addition to all the things that Phil just mentioned, we also are putting a guarantee in place so that we have committed to the product. We will commit to our clients that we know will be successful through that financial commitment that we will make on this solution.
So to speak, put your money where your mouth is, right? And
absolutely.
I think, the great thing about this product is, many times of my 30 years in this business, we've had products come up that give you like a 1-year bump, 1-year lift, and it stops and it flattens out. The way I see this product is that every year there's people that are going for new care, right? Outpatient procedures, ancillary procedures, inpatient procedures, whatever it may be. So this engine is always running and always trying to find, based, no matter where anybody is, whether you're in Houston, Texas, or Wilmington, Delaware, or Vermont, it finds the best doctors in that area and blends high quality with efficiency and cost to make the perfect recommendation. So, and again, every year, I think we're expecting for the Clarity product to see about a 6% savings, and then depending, Highmark will guarantee, depending on the makeup of the group, what the ROI and the guarantee is. So, I think it's a great product in the marketplace, and it's positioned well for that. Lisa, what size clients is Highmark selling this product to?
Any client that has at least 500 contracts will be eligible to participate in Well360 Clarity. The guarantee starts at 1,000 contracts, but each opportunity that we bring to the table is going to be client specific. So that's the important thing. We really want to look at the client specific opportunity, but starting at 500 contracts and above is the spot where we think we'll see opportunity for that client.
And just to kind of play out ROI for the people that are watching or listening, the product is $9, right? And there's multiple ways you can pay for it. But if it's $9 and a 3-to-1 ROI, just based on where cost is, 3%, that's a gross 27. That'd be $27. So that would be a gross 3-to-1 ROI. So now, in full disclosure, we expect it to be 6%, not 3%. But again, the dynamics of the group will range it between 3 and 6%. That's perfect. Well, this is exciting. I mean, this is the type of products that certainly employers are asking for. And there's certainly not an employee out there that would say they would rather go to, in my example earlier, a neurosurgeon that's rated 10% versus one that's 98%. The problem in our existing system, as you all know, is up to now the market has never provided that information. So I think informing people who's cutting into their body, so to speak, who's providing care, is a responsible thing to do, and they can make the decision from then. I often say, if you ask 300 people, who would you rather operate on your heart, a doctor that's rated 10% or one that's 98%? Not one would take the lower quality. So I think people can rationalize that and make a good decision. Thank you for joining me to learn more about the power of provider transparency in healthcare. Stay tuned for more updates on Well360 Clarity, which will be available to employers starting this July. I'm Jeff Bernhard, your host, and thanks for listening to Hitting a Higher Mark.